It's very common for people to have sore joints and muscles, especially as we all get a little older. And it's very common for people to call their family doctor asking for help for this. But usually it's not the family doctor you need to see. Usually it's a physiotherapist. Now, for this talk, I'm not talking about a new injury or a sudden injury where we're worried about a broken bone or a dislocation or a torn knee ligament. And I'm also not talking about a red joint or a warm joint that could be infection or gout. I'm talking about these nagging musculoskeletal injuries or pains that have been going on for weeks to months. A sore shoulder, a sore back, a sore knee, sore wrist, those types of things.
At stewartmedicine.com, and there is a page devoted to musculoskeletal pain. And if you scroll through, you'll see a lot of the general advice. Basically, if something's been hurting or nagging, the general treatment options are rest, ice or heat, compression, like tensor bandages, elevation, pain medications like Tylenol or Advil if they're okay for you, Voltaren, an anti-inflammatory gel, it's over the counter. And then there's this big, bold, large font section that says, if you have pains that are lasting more than a few weeks, go see a physiotherapist and or massage. And sometimes people are often saying, well, I want to know what's wrong. And I'll say that it's almost impossible for us to say exactly precisely what ligament or what muscle is the one hurting. But the good news is it doesn't matter because the treatment for any of those is still the same. See physiotherapy. Plus, it's the physiotherapists that are actually experts in assessing the musculoskeletal problems so they can determine what the problem is so they know how to fix it and advise you.
For nagging musculoskeletal pains that have been going on weeks to months, this is the menu of options. So if you have tried Tylenol and Advil and rest and ice and tensor bandages, and maybe your own home exercises or stretches, and things aren't getting better, as my webpage says, and as I keep reiterating here, the next step is to go see a physiotherapist. So if you haven't seen a physiotherapist for this pain yet, that remains my number one suggestion. So if you were to book an appointment to come see me, we could be sitting face to face, and I'm going to say, go try seeing a physiotherapist as the next step.
This video is framed more about nagging musculoskeletal pains where we're not worried about broken bones or infection or things like that. At the bottom of my webpage, you'll also see a section on red flags to watch for. And then if you have any of these, book a visit to see your family doctor for sure.